This is Ask Dr. Bob, and for those of you that are new, this is where you ask me, Dr. Bob Gabbay, the Chief Scientific and Medical Officer for the American Diabetes Association, your questions about diabetes. And every month we pick a theme, and that's part where I'm wearing this hat because the theme is summer tips, how to be healthy during the summer with your diabetes. And so, please follow me on Twitter at Dr. Bob Gabbay, Facebook, LinkedIn. Tell your friends. And without further ado, we've gotten a bunch of questions. I'm going to take this hat off for now, just to make it a little easier to see what I'm doing. And we'll get started with your questions. So again, this is summer fun and summer tips for Ask Dr. Bob. So first question is, how does heat and humidity affect those with diabetes? Well, that's a great place to start. And I'd say like three things to think about. The first is the impact on your blood glucose levels. And the second is around your medications, and the third around your devices. So let's take each one of them. First, in terms of your blood glucoses. Well, when it's hot out, you need to cool your body. Your body works hard to cool you down, sweating, whatever it might be. And so it's sort of like you're exercising. And what does exercise do to your blood glucose levels? Usually it drives it down. And so you need to be sort of watching out for that it can cause your blood glucoses to go low. And we'll talk about in a little bit, all of the things you need to think about in terms of your blood glucose. In terms of medications, the most important one is about insulin. Heat and insulin do not always go together. Extreme temperatures and insulin, not necessarily good. And we'll talk about that in a moment, about what to do to stay safe. And the third is about your devices. So, if you have a continuous glucose monitor or an insulin pump, sweating, the adhesive can fall off. And so again, we'll talk about that. So those are the three areas, and let's jump to the next question. How can people with diabetes stay safe and healthy during the summer? And I love that. Summer is just such a wonderful time of year. And the bottom line message here is that if you're living with diabetes, you can do everything that everybody else would do. You just have to pay a little attention. So what are those things you have to pay attention to? One, important to hydrate. So you can get dehydrated very easily in the summer. That's true for everybody. If your blood glucose levels are high, that in and of itself can dehydrate you. So it can be like a double whammy. Not only are you sweating, but you're losing fluid because your high blood glucose levels. So stay hydrated. And I think we often are more active in the summer. I mentioned about how sweating and cooling your body is a form of activity, but often we're out and about a lot more in the summertime. So it's important to check your blood glucose more often because things fluctuate a bunch. So don't guess, just check. And then the next question is, what symptoms should people with diabetes be monitoring? Well, this is a tricky one. Normally, the symptoms that people will sometimes use to tell how their blood glucose levels are doing might be sweating if their blood glucose gets low. And you can't rely on that in the summertime when it's hot out, because you may be sweating just because it's hot out. And so don't rely on symptoms to know what your blood glucoses are. Really check your blood glucoses. Don't guess, check. That's, if you take one thing out of this, things fluctuate more in the summer. It's important to check your blood glucose more often. And then, the other thing I would watch out for is heat stroke. Bad problem for anybody, and it just makes it worse when you have diabetes. Fever that may come with really, profound heat stroke, dehydration. All of those things can cause a vicious cycle around your blood glucose levels. They get higher and low and very unpredictable. So stay cool and stay hydrated. All right, let's move on. We got a bunch of good questions here. Here's the next one. Can the heat and humidity affect my diabetes medications and supplies? And yes, and I'm glad you brought that out. So let's talk a bit more about that. For your medications, it's really around insulin. And, insulin has to be at the right temperature in order for it to be stable. And that's room temperature, normal room temperature, not room temperature in the summertime if you don't have air conditioning or if you're outside. The insulin can spoil. And so important to keep your insulin cool. A cool pack is a great thing to do if you're out for the day. You can even do a simple one with a Ziploc of ice, and then your insulin on the outside of that, inside another bag. That'll keep it cool. And then keep in mind, if you're wearing an insulin pump and you're outside all day and it's 90, 95, 100 degrees out, that could spoil your insulin in the pump. And so you may need to change your insulin at the end of the day. So keep that in mind. The other thing I'll tell you, a little thing to keep in mind about insulin, is how you get it from the pharmacy. If you're picking it up from the pharmacy, sure, no problem. You're coming right home and it's staying cool. If you get mail order, it should be packed with ice. If the ice is all melted when you open it up, that insulin may have gotten warm and it may not be good. So you should let your mail order pharmacy know about that. So that's what you need to watch out in terms of medicines. And then what about your devices? I mentioned that when you sweat, a continuous glucose monitor or an insulin pump, that sweat may make the adhesive not work as well, and these things can fall off. I have some patients that have told me what they do is they put a little antiperspirant around the area where the pump site will be, or where the continuous glucose monitor is. And that way there's a little less sweating around there. So a little tip that one of my patients told me about. Okay, so we're talking about summer tips with diabetes on Ask Dr. Bob with me, Dr. Bob Gabbay, and let us move onwards. So are people with diabetes more susceptible to sunscreen? They are not necessarily any more susceptible, but sunburn, they're not more susceptible to sunburn, but wearing sunscreen is a good, healthy habit for your skin. As you might imagine, I am very fair-skinned and I burn very quickly, so I'm always putting sunscreen on. But the next question is, what impact does a sunburn have on your blood glucose levels? Well, it can be unpredictable. Sunburn can be a form of your body exercising to keep yourself cool. It can therefore lower your blood glucose, but some people see that their blood glucose levels rise. So again, don't guess, check your blood glucose. Another question is, what about swimming? Swimming's great. It's a good form of exercise. It's wonderful in the summertime. If you're wearing a device, a pump or a continuous glucose monitor, just be sure that it is meant to get in the water. Many of them are. And check that the insertion sites are still good when you get out of the water. And then the other thing about swimming is it's a form of exercise. You're burning glucose. Your glucose could go too low. But what is the symptom of low blood glucose? For some people, it's sweating. You're in the pool. You're not going to be able to tell if you're sweating or in the ocean. So don't guess, check. And now, here's another question I like. What about amusement parks? Fun place to go in the summertime. I used to live in Hershey, Pennsylvania, where we had this place called Hershey Park. So I used to go there quite a lot. It was sort of a funny place to do diabetes and what's called the sweetest place on earth. That's Hershey's tagline. Anyhow, what about amusement parks? This is another place where your blood glucose levels can fluctuate a lot because you may be rushing from one ride to the next, burning glucose and lowering your blood glucose, but then standing online for a long period of time where you're inactive. So active, inactive, back and forth. Again, don't guess, check your blood glucoses more frequently when you're in that situation. We got a few more here. So what about people with diabetes planning for travel? So summer's a great time for road trips or whatever. And it's important that you bring the right things with you. So medications, make sure you bring your medications and bring extra because sometimes your travel plans may change. You don't want to run out of your medicine. So that's number one. Number two is how you're checking your blood glucose. Bring a little extra supply of that, whether that's your continuous glucose monitor or finger sticks. Bring some extra test strips with you so that you have that handy. And bring snacks because, again, food, access, your routine, everything's a little different when you're traveling. So have it with you. And all of what I described, carry with your person. Don't put it in the trunk of the car because the heat can really have an impact. Have it with you. Have a little pouch that all of this goes in and travel with it. If you're on a plane, make sure not in your suitcase, but with you in your carry-on. And that goes to the other question here. Are people with diabetes allowed to bring their diabetes supplies on a plane? And absolutely yes. And that includes your insulin and syringes. So they have to let you go on, tell them you have diabetes, and you should not have a problem. So this has been Ask Dr. Bob with our summer tips. If I were to just zoom out, what is the big take-home message here? You should really enjoy yourself over the summer. Do all the things that anybody else without diabetes might do, but just pay a little attention. Check your blood glucoses more often. Stay hydrated. Make sure your medications are kept in a cool place. And have a great summer. I will see you next month. If you've enjoyed this program, please tell your friends and family. It's Ask Dr. Bob. We're here every month with a different theme, and you can follow me on Twitter, Facebook, and LinkedIn. And enjoy your summer and see you next